I was taught that type 2 diabetes is not reversible. They will always be there, and there will always be medications. And I was wrong. And I was taught that not as a patient, but as a clinical pharmacist, someone who is well educated, board certified in ambulatory care, long-term chronic medicine, someone who is in clinic trying to help people manage their type 2 diabetes. I was taught this. And I was wrong. For those that don't know me, I'm Dr. Krista, and I'm just going to tell you why I never shut up about this. When I was still in clinic, I was responsible for the entire population of diabetic patients within that clinic, and my job was to improve outcomes. And I was applying the best practices and best clinical updated guidelines I could, and although some people got better A1Cs, better blood sugars, overall people weren't healthy, weren't getting better. And I was considered very good at my job. But that made me feel like shit. So then I thought to myself, what are you missing? This isn't right. You're supposed to be good at this. Why aren't you helping these people? Why aren't you really helping these people? What's wrong here? You need to look harder. So I did look harder, and I found and realized that the nutritional advice that we were providing to patients didn't help stabilize their blood sugars. It just helped guarantee that they would be high enough all the time that they always needed medication, aka the nutritional information we were providing to them actually made their blood sugars worse almost all of the time. And then when I looked again at the medications, the insulin, the pills, a lot of these medications made the underlying cause of the disease worse, which is insulin resistance, which wasn't even being addressed. So now we have nutrition that is fueling the blood sugars to continue to go high by stimulating the release of insulin, which isn't even discussed. And the drugs we were using were stimulating insulin resistance even further. So now the food's wrong and the drugs aren't doing really what they're supposed to do, because we're just masking the main cause, right? Then I looked and saw that the guidelines were really okay with this, and we're really pushing this as the way to help people, because it can't be reversed, right? And so the guidelines were steering people wrong. The food was steering people wrong. The drugs were making everything worse. And then when you look further, you see that the education system that people, myself included, went through continued this and was really encouraging not to go outside of this algorithm. And then I put my gaze wider and realized that the standard American diet and everything we've ever been told really about nutrition in this country, and this is not a no-brainer now, is actually set up to really encourage people to nutritionally be unbalanced, and they will head eventually into prediabetes and diabetic land, which is really clear to see when you look at the rise of diabetes in this country. Then it got worse, because then I realized that diabetes is a disease that touches every cell in the body, both by high insulin levels and high blood sugar levels. And if you touch every single cell in the body, every single cell is affected. It's inflamed, it's mutated, it's made radical. And so now you have diseases coming up that wouldn't have happened if they had not been diabetes. So now we're not just dealing with high blood sugars and high insulin, we're dealing with nerve damage, obviously, heart disease, obviously. Not from necessarily, again, the fats that everybody's so scared to eat, from the inflammation, from the high blood sugars, from the constant corrosion in your vessels, but it doesn't end there. Cancer cells are fed off of high sugar. You know, you can't really be mentally clear with high blood sugars and high insulin in your blood. So now we're talking about mental health, focus, clarity, depression, anxiety. We're talking about new cancers. We're talking about problems with your gut. We're talking about problems conceiving, because it's hard to conceive when you have high insulin levels. We're talking every system affected on like so many levels. And then I realized that on so many system levels that are touched, that means people are on medications from every single category of disease that there is, which is true because I've seen thousands of medication lists. And we're perpetuating a culture that thinks that this is normal because so many people are going through it. Then I realized with so many medications being made and sold in just the United States, it's very unlikely that people are going to get on board to help millions of people who are on those medications get off of them. And that's why I never shut up. You're right. It is a lot to think about. It was a lot for me too. But that's why it's just one thing at a time. One thing at a time. Just keep on going. I love you. Bye.